Well, in general, I think a patient-specific model has several advantages. One, particularly in my area of research, which is congenital heart disease, is that the uniqueness of the case is preserved. So in congenital heart disease, the anatomies are very complex and the repairs are very complex. So the result warrants really the use of a patient-specific model to appreciate all the complexity of each case, but also the possibility of looking inside, in a sense. So to look inside a defect, again, I'm speaking specifically for congenital heart disease, and look at the intricacies of the anatomy by opening the model physically, that's possible, so that's a great feature. I think the 3D models can have a valuable application in communication between parents of children with congenital heart disease and their cardiologists, and we have explored this recently in a study asking about 100 parents that had a model used during their consultation. There are benefits potentially, as in both the non-expert user, so the parents, and the expert user, so the clinician, liked the models qualitatively, and they did feel that it helped in the communication. The cardiologist reported that all parents interacted quite well with the model. 3D models can be very helpful for parents to visualize the defect or the anatomy of the children and understand what actually will be carried out during a procedure. But it is important to test this potential improvement in communication because there are, for instance, elements of shock that we should take into account. We can imagine that for a parent or a patient to see the actual anatomy or his or her own anatomy can be shocking. And this turned out not to happen in the study that we conducted, which is important to evaluate for communication. However, on the other hand, short-term knowledge did not appear to improve significantly. And although we have to say that knowledge is very difficult to quantify, and we just looked at short-term and not long-term parental knowledge, it did seem that although there was a general liking of the additional visual medium of a 3D model with respect to what's normally used, which can be sketches or leaflets or generic models. So despite the overall liking, the knowledge short-term did not improve overall. And that can lead to further research in how we can change the models to make them more effective, or how we should design the studies to truly probe the knowledge and the understanding of these families.